Skanowania sedenie z wodką. Można na każdy. Albo mam i każdą stronę.
Ale to jest wobec tego już to nie jest. Każdy ma swoją pracę. Ale my im nie pomagamy. Tak?
A kto tu masz na robotę?
Każdy ma swoją robotę. Rozprawa jest też, że zapieczą i nie chodzi. Najwiac. Że nie mają rodzin, mają na tomek.
I uczennicy, koliko pani ma? Nie rozumiem teraz.
78 Ravela, nie? 8 Ravela.
No, 80 było kondycji.
Możecie zapnąć?
Może zapnąć.
Feet.
So, good morning. Can you hear me?
So you have to do by yourself from the start, from the puncture
Yeah,
to
yeah.
cross?
In this case, if I do it robotically, yes. Ešte ste mu mohli dať príkladne flašku.
Hello.
Hello.
So at the beginning we start with just with
So I'm allowed to take picture of this one?
for sure.
Okay.
No problem.
2,5 heparinu.
So now I inject heparin. Our habit is to flash to introduce it only with saline, and we inject the heparin intravenously then after. Usually 1,000 units per hour. And I use also specific wire with a marker of 90 centimeters, so it's not necessary to use the fluoroscopy. From this moment I start to use the fluoroscopy. And I puncture with just other ultrasound control.
So she's a French, she's French.
6, yeah.
6.
It's just my.
I'm trying to check some protection.
It's yeah, it's a zero gravity.
Oh, very interesting.
So it's better for the fun. Monitory trošku dozadu, poprosím.
Ano.
So the analysis is located on the right side.
For the location? Right.
Actually. Take the sample of the blood to measurement of activity pressure, appetite.
Odber. Pinka.
Či ten link vyšetrova niekomu poslať? Na streamovanie.
Opýtaj sa tam vedľa. Just perform the rule. Ready? So, usually, normally we use a little bit different one connector.
Why we have to do different? Why we have to do different?
For this robotic system, it's mandatory to is compatible only with this one. Because I'll show you later. It's just easily to open and close with some pressing the button. Personally, I don't like this too much. And the other one, which we normally use, has a double silicone belt. It's really good, even if you put two devices inside.
What is this access devices? Sophia?
It is now from
What centimeter?
it's a 95 filter.
95.
95 centimeters. We use
Filter.
80 centimeters of introducer this time, and 95% of so 95 centimeters.
So
of-
80 centimeter of the sheath and 95 this access.
Exactly.
So this is good for robotic, right?
Yeah.
So normally, otherwise you don't need this. For the robotic, especially
Even I do it manually. It's the same procedure or some similar.
80 plus,
the
80
same.
plus 95.
Yes.
Okay.
And now I can go a little bit up for better stability.
Absolutely.
Zip si prosím. There is some totality, so I don't want to push it too much because in which case I can some dissecting. I think that is a good, you know, in this position, but I want to be sure. Yeah. What percent?
Normally, for the robot, you don't control the face access device, so you only control the microcatheter and the stent.
Yeah.
That's just two devices, right? Two devices.
Yeah, exactly. The problem, yeah, this is the
But technically, you're able to control 3 devices, right?
yeah, this is the main device.
But this is just you are controlling microcatheter and stent only. Okay.
Yes. And both the lateral movement of the table. So we will do the 3D acquisition. I will stand there.
Dobra, za sekundę jeszcze zmawiamy wtedy. No, nie ma mobilami bliżej. Właściwie bardziej wtedy usuwam. Monitor posunę.
Petnaest množstvo, 2,5 liter per second. So we use 15 milliliters of contrast media. You can go out for acquisition.
Mamy saturację.
Poczekaj sekundę.
Tu jest 12 kanałów, a to kanał jest posuwany.
Okay. Find the optimal projection. Hey. Technically, it would be possible to put a pulse as well, because of this angulation, we really prefer to put this. Yeah, I know, the night is 3 point. Takže veľkosť anorizmy 4,75 krát 6,32, krčok 3,37. Just measure the diameter of the aneurysm. Shape is a little bit irregular. Not so much. Okay, so this will be the working position.
So where will be landing? So wanna cover the thoracic or not cover?
I will cover it.
You cover, right?
Yeah.
How about the bifurcation?
Pardon?
Bifurcation, IC bifurcation. Start from MCO or start from just?
No, I start from
Just this way, I see.
Yeah. Yes. Okay, so I just want to measure the volume aneurysm. Time to time, I don't know why, but time to time this automatic software does not identify the aneurysm, so it's possibly to.
No, I don't do that.
Yeah, it can be identical. So as you can see right now, it was not detected. So I try to. It's not good. Okay. So we'll start a little bit probably here. And so device. We need to calculate the length of flow director. I think 4.5. So in such case, if it's not like this good. So
4.5.
4.5, yeah.
15 or 10?
I'll just try to.
15, 10.
So, okay. And check. Okay, this is the working position. I do just the regular standard view. Monitory trošku k nohám.
Áno, idem.
Aké množstvo? 2. Working position. Store this. Run. I have selected the images for smart mask, and we will do the aneurysm flow. 6.2. Môžeme mikrokateter? Áno, áno. I prefer to have a distorted angle, so I use 45 degree. 27, right. And for robotic system, we need to have this connector, specific connector, as additional. That's an additional part. So again, this is a specific. Epsilon connector.
Why this specific one? Very special.
Because no other one can be.
To me, it looks like the same.
Yeah, it is the same like the previous one, but as I said, normally we use a different one, but only this one is compatible with this robotic system. So if you want to open it, you need to push like this. Yeah.
Okay.
So and we have something like button here. I show you later. So I go back this, okay. And now I start with
So for robotic, you don't use the maximum zooming?
Pardon?
No, the zooming. What about the zooming? Zoom in or zoom out? I think this is still there is some room for the zoom in.
Mm-hmm. No.
Yes. Normally you don't zoom. This is only 27. So normally maximum zoom is 15.
Let me tell. Reason that I want to see, if I do it robotically, I want to see the position of the guiding catheter.
Okay, okay.
Because in such case, you cannot, without this, you cannot control the position of guiding and potentially
Okay.
you cannot go back, yeah? So, I've done too much. Now I switch back. I switch back to 3D. Time to time we think that this computer is too slow. So I go back from Anderson flow to 3D. And this is the usual layout. What we do, this is on the right. We have reference image. This is a smart mask that we use. You need to put here some specific connector. But that's fine, this is the only one compatible. Okay. We connect this and the system is ready to use. Current fluoroscopy time is 1 minute. 9 seconds.
Skiaskopický čas 1:09.
So for remote,
Začiatok robotického šetrenia.
For remote, it would be mandatory to have some other. So the middle one is for the guide wire. Middle one. Pressing the neck is. I usually use a vertical branch.
okay, already have.
Yeah, and now I'll go back with the wire.
1:40 zavedený mikrokateter.
And okay, we can use the flow repeater.
Tu som, pán docent.
Okay, sorry. So, it's like this. I don't need to use fluoroscopy thanks to the markers on the robotic. I wait for a flash.
So why do you need this big white cube? This for injection or
This is for, because if you move, you manipulate with the position of the microcatheter. So I wait for the drop. It's here. So I just push it like this. Okay, and we push regularly.
Okay.
Thanks to thanks to this marker, it's not necessary to use the fluoroscopy.
Exactly.
So I need to, or I can push it more distally up to this position. The markers are here. I close the system, and I can go up. 1:40. And this button is for whatever. I can increase the speed with this left button. And now I can go left. Yeah, the microcatheter is straight. Trying to keep this position. So the floor is starting to be open. Now I can switch to inside the system. The floor is open. If you want to be sure, you can go inside, as you can see. You do some internal massage. Now I can go back. Stand is still open.
Stand.
Microcatheter is
350.
So the total fluoroscopic length is 3 minutes and 50 seconds. Single.
So you don't check any dynasty or exposity to see the wall.
We can do. We can. No problem. And we can check the flow right now. 8.2. That's the main limit for this generation.
So if just for embryon, it's a little tricky if you put the two microcatheter inside or right?
Yeah. So that's why it's not possible to perform, for example, balloon remodeling. Yeah, because potentially, it would be-
Technically, yes or not?
Technically, if you use the epsilon connector, potentially, but you should change the manipulation of one device and with the second device, and every time it will be mandatory to do it. So I don't think it's a good solution right now. But yeah, this is the just first generation. Let's see. So the stent is implanted. You can see the contrast stagnation in aneurysm, actually. You wait for the next run. is the stent. Stent is implanted here, from here to this point. Okay. Jednu fotku poprosím. Môžete.
Ale tam pošlám potom na iné. Môže byť takto a fokus asi. Mal byť.
So just for documentation. Now I can.
Documentation for using the robotic.
Well, we recorded every case, so it's well documented. So now this is the story. If I need to switch to manual, it's like this. You just disconnect and open this, and you can do it. So it's just really few seconds. Yeah. And now I start.
Right? So, now you can do the menu.
Exactly. So, but of course, there must be some person able to do that. So it's our standard. We do the second run after 5 minutes, 10 minutes, and 20 minutes, and then we
So how long you wait? 20 minutes?
20 minutes.
20 minutes.
We keep the patient on 20 minutes because if we see, we check. It's very rarely, but time to time we can see some thrombi inside. It's really very rarely nowadays when we regularly check and deficiency of antiplatelet therapy, and it was okay. So I don't estimate any problem. Okay, môžeme. The most important thing is that there is no delay of pacifying of middle cerebral artery territory. All branches are patent. The next round will be after 10 minutes.
Okay.
Môžeme dať 6 vám potom na aneurysm flow. Hej. So here you can see nicely implanted stent. This is the aneurysm sac. And you will see the contrast stagnation during the... Yeah, for sure.
So when I remove the slack, right? Sometimes they use the older system. So
Yeah,
I think
yeah.
that, you know, this is better. So because you can get a very small movement. with
Exactly.
1 millimeter, right?
Exactly.
Am I right?
Yeah, for
So
sure.
with the expert, I think we have upper hand, but normally we'll compare with the normal person. normal physician. So
This
we can
is,
get that,
yeah,
right?
the manipulation is really, really precise. This is the main advantage for me. This is
But
the main-
sometimes you can use torque shutter, but you know, if you want to do more precise,
Yeah,
you
yeah,
can use
I use
it's 1
less than
millimeter,
this.
right?
Less than 1, it's just 0.1, 0.5. It
So
depends on generation of this, but in this case, I think it's 0.5. It can be more precise. It was, it is a plan to do that, but yeah, we will see what they will bring for.
Sometimes when you deploy, you know, sometimes you want to keep the catheter, and sometimes you can push the.
I did.
You have to,
I
right?
did with the
Pushing and then
yeah.
protect, right? Pushing protect is the same.
If I see that some let's say the big tension in the
But initially you have to remove the slack,
Yeah.
right?
Yeah.
Initially, you know,
Yeah.
exactly the same, right?
Exactly.
You can just, you know, remove the slack to protect the catheter, you know,
Yeah.
with the shutter.
Yeah.
And then once you are ready,
Yeah.
so you can using simultaneously
Yeah.
with 2 hands, right?
Exactly.
You take the same.
Yeah, and
But
basically.
only on difference, we don't
Yeah.
have haptic, but you know, right?
Yeah, but you can evaluate it according to some visual
But,
marks.
you know, am I right, sir, that, you know, expert, you know, compared with expert, I don't think, you know, this is a superior, but, you know, compared with the normal, you know, intervention is really new, so it has a very less learning curve. But you insist, no, this is better than expert.
In some very precise situation, potentially it can be better than the expert.
Oh, yeah, that's
Especially if you need to really place to border of bifurcation, or if you do not want to gel another branch or something like this. So in such case,
But from here, you know, when you do the learn and you are not satisfied with the oral position, so you can do the learn interpretation manually.
in this case, officially, yes, I did once with this robotic system, but as I said, in such
Technically,
case-
it's feasible for
Yeah,
you, robotic,
yeah.
right?
yeah,
But, you
technically-
know, but inflation balloon, you know, you have to do it manually.
Exactly, exactly. But you can control that. Or, but basically, when we perform angioplasty, the regular one, I ask my nurse to inflate the balloon. So it's possible to do that remotely. Really. I'm just checking the time. Okay, it's 10. So what we did is unreason flow.
But this cassette is the disposable, right?
Yeah. Basically nowadays they have more the next generation of this software. It's not the last one, let's say. So I have to edit a bit. So I stop this. Move to the center. I select the region of interest. So I can add some area like this. This software needs to some improve. course, we can debate if it's really necessary or not, but
No,
yeah.
don't do it.
Yeah, of course, it's possible to do the procedure without this. But we are collecting the data, and the aim is to maybe decide. Of course, this is just only one factor.
You mean stagnation?
Stagnation for sure. You can measure.
So once
biological
you are
response.
treating the joint in very large, there's a big stagnation. So
Yeah.
do you have another special resident to, preventing thrombosis or?
Yeah, as I said.
Sometimes it's good and bad, right?
Yeah.
Big stagnation after putting the flow diverter, right?
Yeah. So you can see changing of the phone. As I said, for me, nowadays it's too slow.
Yeah, sure.
But we use this time for between the 10 minutes and 20 minutes.
You can see the difference, right?
Yeah, to perform this study.
So initially, when you have a initial experience flow diverter, I do use this a lot for every single case I did is in flow, but now I don't do that.
Yeah. To nám hovorí viacej, že sa iba kamera. So, you can compare the flow. Including vectors. So you can clearly see that the red color is with the high flow, and here you can see the blue one. So you can clearly see that the decrease of the flow to the aneurysm after flow dilator implantation. And we can also check this perfusion curve. Yeah, the MAFA index is 0.65.
Less than 1.
Yeah. And this is the time intensity. You can see that the peaks are not as high.
Yeah.
So I'll just store the images. We perform some statistical analysis, and it's close to statistically significant results. So we just need more data for that. So that's it. I can go out from this software. We do again the standard. It's 80 minutes. You can wait another 2. Just store this run. And here you can see the 3D image of left territory. No artery is absent. I switch to standard position. I use the automatic position system. Don't use the fluoroscopy. Single. Okay. Good. Okay. You can see that now artery branch is missing. So, would you like to perform this follow position?
We'll see. Anyway, start.
Do you inject the contrast media? Yeah. Okay.
Yeah,
Diluted or just regular one?
regular. I'm sorry?
Diluted?
Diluted.
Diluted.
Definitely diluted.
Because
Definitely diluted.
yeah, because
Yeah.
but just technically, we just decrease the flow.
Yeah, digital.
Okay. So I pull a little bit back.
Yeah,
Okay.
very diluted.
OK, poprosím množstvo na tejto pomôžte. Dajte tam množstvo 10, 0,1 výtok. Okay. 5 sekúnd, hej? So the aim of this last acquisition was to check the position of the border data, the vessel artery, and you can see okay. Okay, increase. Looks okay. Like this. So recording of môžete
Ještě angio.
Môžeš už angio.
Šestkou.
Angio.
Here you can see position of proximal part. Correct. And distal part as well. Radial part.
Yep. No
So-
complaint.
It's okay. So finally we just perform the occlusion on the puncture side. Okay. Again, we can use the fluoroscopy for that.
What do you use for closing?
Mostly like 3 to 6 French.
Mean.
APTP,
Odbery
mužka.
Yeah. But now we have another one. Basically, because we will continue with the heparinization of the patient for the next 24 hours.
Oh, you put the heparin for 24 hours.
Yes.
Okay. So you mean
Again,
infusion or normal expression?
normally, it's our standard.
I'm sorry?
It's our standard.
No, what kind of heparin?
Regular one.
Regular.
Yeah.
You check the.
Yeah, we check the FTP. So here you can see the very nice the district is a marker.
Okay.
It's 90 centimeters from the okay, 90 centimeters from the distal lip, so I just put a little bit more. Then what I do? You don't use the fluoroscopy.
You don't need the shift, right?
No.
Čiže vás nepočujem.
Just check the position.
Jak flash fotoreporter. Ste jak flash fotoreporter.
Môžem tam dostať?
Už čo tu jedno
Ako môžem dostať?
No.
Ako vykonáme implantáciu stentu, ale aj embobizáciu, nie? Dobre.
Okay. And this system is also good.